I have this moment, I remember sitting in a waiting room while my mom was at the front desk talking to the receptionist and asking, like, did they have special pricing, if you didn't have insurance, if she had to pay in full. And I remember hearing how much money it was to see the doctor and feeling guilty for being sick. And I think that's nothing any parents ever want to put on their child. That definitely it sat with me for a long time. My name is Nicole Seward, and I'm a pharmacist at HealthPoint Bothell. Growing up, I think like a lot of families, we were uninsured or underinsured for a good part of my childhood. And I also remember how resourceful my mom was, always finding ways to get what we needed, and she relied on pharmacists a lot, asking questions. One time I had really bad eye allergies and my eyes were just itching like crazy. And we went to the pharmacy and they had a recommendation and I got what I needed, and that was a big deal. And when I decided that I wanted to get into healthcare, I thought I wanted to be the free person, that people could just walk up to and ask a question and I would be able to help them out. Before I worked at HealthPoint, I worked at a regular retail pharmacy. And I liked the fact that people could just walk up to me and ask questions. I could make recommendations to them, but I don't think I was really prepared for turning people away from the medications that they needed. You know, the first time that you have to tell somebody that they can't have their insulin unless they can pay $400, or they can't get that inhaler for their child unless they have the money to pay for it. It's pretty heartbreaking, and you just have to stand there and apologize and not have an answer for them. And I think that was definitely the hardest part for me. What I love about working at HealthPoint is that I get to do what I actually wanted to do when I chose pharmacy. I get to provide patients the medication that they need with no barriers. We don't turn patients away. We find a way to get them what they need. And our 340B discounts are a huge part of that. We pass those discounts directly onto the patients. And the first time I really experienced like how much HealthPoint is doing for its patients, we had a patient with HIV come in, and there was 2 medications that they were getting. And it was before we had a specialty pharmacy to help out with those sort of things, and they had a high deductible insurance. So they have to pay the full price of their medications before their insurance kicks in, up to like thousands and thousands of dollars. And this person's monthly copay was $800 a month, and we didn't get 340B pricing on the medication. So we didn't really know what we were gonna do. We couldn't just change it to something else. It needs to be what it needs to be. So we called our pharmacy admin to kind of ask what we could do for the patient. And they said, well, just find out how much they can pay and charge them that much. And that was just like the coolest thing ever. And we didn't just find out like, how much can you pay this month? But we kind of talked to the patient. It was like, how much do you think you can pay every month? Let's think about a year of this medication and how much you can afford. And that's how much we charged them. And I think that just really shows how we take every penny that we get and we just give it back to our patients and take care of them, and how vital these discounts are to help our community. I think it's what every provider hopes for in healthcare. We get to give people what they need. I've worked here for about 10 years and I just love what we do here. Watching people's kids grow up is pretty cool, because you see them come when they have a newborn baby, and then you know they're a toddler, and next thing you know they're walking up to the counter with their mom or dad, and it just really makes you feel connected, I guess, and gives you a sense of how long you've been in the community.